Okay, good evening, everyone. We should be live here in a second. Okay, fantastic. Looks like we have the video. And let me see here. Let's minimize this and we will present from beginning. Okay, I'm Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Tonight I'm talking about anxiety. Because a large percentage of our patients have it. My background in this was such that working with a lot of chronic pain patients like fibromyalgia or who had fibromyalgia, a large percentage of them had anxiety, and it quickly became apparent that the anxiety had to be dealt with. A number of them were on medications or they didn't want to take medications, and most of them were involved with psychotherapists, and they were having some results, but maybe not the results they wanted to have. So this led to further exploration, and as time will have it, a lot of people come to Gates Brain Health for management of their anxiety disorders from a natural perspective is what they're searching for. So tonight I'm going to talk about how anxiety literally rewires the brain. How anxiety rewires the brain, and maybe you'll again get some information from this that's useful for you. Now, this is a picture out of the Principles of Neuroscience, as I commonly cite this textbook. It's fantastic for visuals. And here you can see the medial wall of the brain, as we term it, and the temporal lobes. The medial wall of the brain is if we take the brain into its separate components. And this middle part of your brain, particularly above the corpus callosum, out here in the orange region, is referred to as your limbic system. Your limbic system is your emotional processing area. The principal area of the limbic system is your cingulate cortex, which you can see here in purple, referred to as the cingulate gyrus. I'm going to unbutton my collar here so it's not so tight. And so with that cingulate gyrus is the area of our brain where we have a lot of modulation of emotions. That's where it's really important. It's also important to understand that our amygdala here sits right in front of our hippocampus, our memory area. The amygdala is so important from a humanistic standpoint because the amygdala helps us to sense fear. So if we go back however many thousands of years, let's say 2,500 years, and you're in the middle of nowhere and an animal is coming up towards you, you want to have a fear response if that animal is dangerous, if it's something like a lion or a tiger, to mount an attack or to run away as fast as you can, to do something as part of the fight-flight reaction. The amygdala is really the centerpiece of the fight-flight reaction, and it's what coordinates, in many regards, your fear-based responses. And amygdala is also really good to sense, if you're standing on top of, let's see, Mount Rushmore, if you're standing on top of El Capitan and in Yosemite, that you don't want to get too close to the edge, for example. So amygdalas are really advantageous for us. However, the amygdala in anxiety patients tends to be too dominant. It's firing off kind of haphazardly or just tonically at too great of a level all the time, which can then result in a person feeling anxious all the time, or maybe if we're talking about social anxiety disorder, the person feeling anxious when they're in social settings, or it may relate to post-traumatic stress disorder for someone who's been through childhood trauma, and now when they're in similar circumstances, they're getting these immense feelings of anxiety and dread and panic, given that context or the cueing, so to speak. And so, yes, as one of our Facebook engagers mentioned, hooray for neuroplasticity. And we can really develop neuroplasticity in these fear circuits of the brain, which may have a negative impact on our daily functioning. So neuroplasticity can be good, and it can also be deleterious, so to speak. So this article out of Neuroscience documented the volumetric associations between amygdala, nucleus accumbens, and socially anxious tendencies in healthy women. And I'll just give the carte blanche statement at the beginning of this, in that I'm going to talk about different components of the anxiety disorders, not just generalized anxiety. It's important to understand that generalized anxiety are individuals who feel anxious all the time. Basically, they've felt that way for typically more than several months. They have a tendency not to sleep well, and that is generalized anxiety. And it's in the absence of another disorder, such as schizophrenia, where someone's really paranoid, or it's in the absence, to diagnose it just as that, the absence of something like obsessive compulsive disorder. So generalized anxiety disorder are individuals who are just generally anxious all the time. Then we have social anxiety disorder, like I mentioned, and then you can have post-traumatic stress disorder, and you can have other phobias. You can have, needle puncture phobias. You can have snake phobias. You can have phobias regarding a number of things. But the underlying current of all these diagnostic labels is this hyperactive amygdala, going up to the slide up here. So this hyperactive amygdala, and lots of times going even a little bit deeper into the roots, is this correlation with childhood trauma. Now, not all anxiety disorders, not everyone with anxiety has a history of childhood trauma, but childhood trauma certainly increases the risk of developing an anxiety disorder later on, let alone post-traumatic stress disorder. And so we will be talking about that. We will also be talking about genetics, because some individuals don't have a history of childhood trauma. They're saying, well, why am I anxious? And it may tie in with genetics, or it may tie in with other life circumstances, if it's something like social anxiety. So here, basically in this article that I just started mentioning, they said their findings indicate that higher social interaction anxiety in healthy individuals is related to amygdala and striatal volumetric increases. These brain regions are known to be involved in the social perception, anxiety, and avoidance of harm. So the avoidance of harm is also an important point for the function of our amygdala. And that's why we have a fear-based response. But again, in anxiety disorders, this fear-based response is untempered, and it tends to go on and on without being modulated as much as we want it to. So what this means is that they saw definitive changes in hypertrophy of the amygdala. In this study, I believe they saw enlargement of the right amygdala. They also saw that the nucleus accumbens, which is a dopamine producing area involved in emotional processing and cognition, that area was also increased. Here you can see some of the functional MRI scans where they're showing that amygdala being lit up, as well as areas of the nucleus accumbens and other areas of what's referred to as the striatum, which for the emotional processing piece is more your caudate nucleus. Okay, so I just put this article in regarding social anxiety. Here it's titled Social Appearance Anxiety, Perfectionism, and Fear of Negative Evaluation. Distinct or shared risk factors for social anxiety and eating disorders. So in this article, they basically found that perfectionism wasn't associated as much with the social anxiety or eating disorders, but fear of negative evaluation and social appearance anxiety definitely did interplay with these two disorders, which would make sense. But that's also something important for those of you who are talking to therapists, to be aware of one's thoughts, to discuss those with your psychotherapist and saying, okay, well, maybe I'm anxious because I have this fear of how I'm appearing when I'm in these social situations. Maybe that resonates, maybe it doesn't, or maybe I'm afraid that they're going to think negatively of me, because humans are pack animals. We like to be with the group. We like to be accepted. We don't like to be alone. And so it's natural for us to kind of want to be liked. And so if you're in a social situation and you're feeling anxious, maybe it ties in with you having a fear of, not being liked, or a fear of how you're appearing, or a fear of others not responding well to your presence. I won't go into that article as much. Okay. And then this article looked at individuals who had been exposed to childhood trauma, and they basically found that their cingulate cortex, which I had mentioned earlier, forms a major piece of the limbic cortex. So this is your corpus callosum, this is your cingulate cortex. Limbus means around, if I remember correctly, in Latin, so this is your limbic system or your cingulate cortex. And they, in essence, found in this study at a neuroimage published in 2019 that those with childhood trauma had abnormal activity in their cingulate cortex, and they thought that that had to deal with not being able to dampen anxiety. And so the way the brain basically works is that we have a neocortex to think, or neocortex is this massive, what we would call gray matter on the outer surface of the brain. We have all this gray matter so we can think, but also so we can inhibit unwanted activities. So if you think of a Parkinson's patient, for example, who has a tremor, their tremor is a lack of inhibition of unwanted activity. Or if you think of Tourette's, Tourette's is a lack of inhibition of unwanted, words, or it may involve complex motor and vocal tics where someone has an unwanted movement or a head twitch or some other hyperkinetic activity, as we would term it. And so when we have good brain function, we're able to dampen. And when we have circumstances not allowing good cortical function, then we can get unwanted emotions, thoughts, eye movements, and movements. And that really goes into the basal ganglia and how it works. But when we look at the brain, we're thinking of, okay, so out here is our motor cortex. So for example, our motor cortex is out here. The motor cortex does what? It involves moving your opposite limbs. Over here, you're going to have your frontal eye fields involved with moving your eyes to the opposite side. Well, where's emotional processing? Emotional processing from a cortical standpoint is in your cingulate gyrus largely, and other deeper areas of your temporal lobe. And so it makes sense that they saw in these childhood trauma, we could say subjects or victims, that these individuals who've been through childhood trauma, that their cingulate cortex wasn't working appropriately. It wasn't working at the same degree as those without childhood trauma, which then may make them more vulnerable to not be able to shut off that hyperactive neuroplastic amygdala, like we were talking about before. So that is something to keep in mind. And then this is a functional MRI image of the rostral anterior cingulate zone, as they were commenting on. Okay. Volumetric brain differences in clinical depression associated with anxiety. Basically, in this study, they found that adults with depression and comorbid anxiety had significantly higher volumes in the amygdala. It makes sense. And then we get into genetics. So genetics can interplay with our environment, basically with our circumstances, and they can have effects on the way our brain is wired. Also, you can have genetics having effects independent of environmental circumstances, if let's say you didn't have adverse early life circumstances. So the COMT enzyme, as I've talked about in other broadcasts, basically breaks down adrenaline, it breaks down norepinephrine, it breaks down dopamine. And so individuals who cannot break down those chemicals have a tendency for those chemicals to be really high. And if you have really high adrenaline and you have a history of post-traumatic stress disorder, which already fosters more adrenaline, then maybe that would say you're not breaking down adrenaline like hardly at all. And that may have manifestations on your brain because hormonally, the higher your adrenaline is and the higher your cortisol is chronically, then that can basically lead to connections in your frontal lobes not being as dense, as well as atrophy of your memory area, which tries to shut off your fear center. So COMT polymorphisms can be super important for basically individuals with anxiety. And they said, our data demonstrate childhood adversity and COMT genotypes are associated with abnormal brain connectivity. So childhood trauma combined with the COMT genotype is associated with a brain that's connected differently than someone without those circumstances, structurally and functionally. Early identification of individuals at risk, assessment of brain abnormality, and cognitive interventions may help to prevent or limit negative outcomes. So that's from Brain and Behavior. That's a big, big statement. And I think it's so important because I like to show you all that if you're feeling anxious, lots of times people wonder, why am I feeling anxious? Why do I feel this way? And what is wrong with me? How am I broken? And it's not per se that you're broken, it's just that the brain has changed. And this is where it's so important for us to get this information out to, let's say school counselors, so that kids can be worked with who have been through pretty traumatic circumstances, maybe at a younger age, so we can give them better coping skills through psychotherapy so they're not dealing with as big of a snowball maybe later in life, or they need to go see a psychiatrist because maybe medication may help them, or they may need to see a functional doctor focusing on brain health because maybe there are some certain natural alternatives that may be a benefit for this individual. So that's important. And this is another article from the Department of Veterans Affairs, basically showing that PTSD and childhood trauma are linked, and their findings support the hypothesis that gene, times, environment interactions underlie associations of this COMT polymorphism and fear inhibition deficits. So basically, if you have the COMT polymorphism and your adrenaline and dopamine are going to be really high, then you may have a limited capacity to inhibit fearful stimuli, if that makes sense. And so a fearful stimuli to you may be twice as much as it is to someone without this COMT polymorphism. And those are the articles. Okay. So the take-home point is that genetics interplay with our circumstances. That can all interplay to affect how our brain is wired. And then I think approaching anxiety from a multimodal standpoint is really great, in that cognitive behavioral therapy has been shown to actually reduce the size of the amygdala, the fear center, in those who have anxiety. So just as I showed you articles demonstrating that anxiety patients have enlarged right amygdalas, by the same token, cognitive behavioral therapy with psychotherapists has been shown to shrink that amygdala. And so having the cognitive strategies when a person is in a stressful situation to say, oh, I'm feeling this way because of maybe this aspect of my life, or I'm feeling this way because this happened to me in my childhood. I think that's really important. So seeing a psychotherapist can be great. Seeing a psychiatrist, if that's your proclivity, who may be dealing with serotonin metabolism to build back your memory area, which can basically inhibit your fear center, that may be a big benefit. Or working with someone from a natural standpoint with supplementation and maybe co-management can also be a positive effect. But just know, if you're feeling anxious, it's not that you're weak, it's that the brain has started to change a little bit lots of times. And let me know what you think. Okay, so let me just see if there are any YouTube comments. I don't think so. Okay, so we're good. And that, and to all